In this talk, we're going to discuss cancer screening. We'll talk about what cancer screening is, what the goal of cancer screening is, what cancer screenings are available to you, why you should participate in cancer screening, and we'll also have a slide where you can find some more information on cancer screening programs. First, it's important to keep in mind this talk is created by medical students solely for education. It's not to be used as medical advice and does not replace going to see your doctor. So, cancer screening. A lot of us are familiar with some of these tests and programs, such as colonoscopy, mammogram, and pap smear. So we're going to be talking about those different tests today. So what cancer screenings are available? So there are 4 cancer screenings that are recommended by the Centers for Disease Control, or the CDC. Those 4 tests are colon cancer screening, breast cancer screening, cervical cancer screening, and screening for lung cancer. Those first 3, colon, breast, and cervical, are recommended cancers to get screened for all people, all adults, whereas lung cancer screening is only recommended in a certain group of people. So that's going to be people age 55 who have a heavy smoking history. So let's start with the first screening, so colon cancer. So colon cancer screening should be for all adults, and when is it going to start? So it's going to start at age 50 for most people. Unless you have a parent or sibling with colon cancer, then it's going to start at age 40 or 10 years before their diagnosis, and it's going to be whatever is earlier. So for example, if your parent had colon cancer at age 45, you would want to begin screening at age 35, 10 years before when they were diagnosed, as opposed to age 40, since 40 would be later. So it's going to be 10 years before their diagnosis or age 40, whatever is the youngest for you. And what screening tests are available? So there are multiple screening tests. The most common one and the best one is colonoscopy. And by best, I mean that it detects cancer at the highest rate. But it's also the most invasive test. So there are other tests available, such as flexible sigmoidoscopy. So what that is a test that requires less sedation than a colonoscopy, but they only look at the most far down portion of the colon, so you might miss some cancers that are higher up in the colon. So colonoscopy is the best test, but there are other tests available, and that's important to keep in mind. These 2 other tests here are FIT testing and fecal occult blood testing. So these tests are stool sample tests. They're done once a year, and they can be done in the privacy of your own home. So you can get a kit sent to you in the mail. You take a stool sample yourself in the privacy of your own home, and you can send it into a lab, and the test results will come back positive or negative. If they're negative, you don't have to do anything except retake the test in a year. And if they're positive, you just have to schedule a colonoscopy to take a look and see why that test might have been positive. The next tests we're going to talk about are mammograms. So doctors and researchers are still not sure at what age is best to start doing mammograms. Some societies say age 40, others say age 50. The benefits of starting earlier is you're going to catch more women with breast cancer, but the downside of starting earlier is that you're going to get more false positives in healthy women that don't have cancer, and then you're going to put them through all these additional tests. So the question is whether or not that is worth doing to pick up those extra cases of cancer. So this is a personal decision that's up to you, and talk about it with your doctor to see if starting at age 40 or age 50 would be best. The other test is cervical cancer that we're going to talk about. So this begins in all women starting at age 21, and it's done every 3 years. And the test is a pap smear. It's done in the office, and you get your results back in a few weeks. And your options will either be to come back in another 3 years if everything's fine, or to come back sooner if they find something abnormal. Once you get to age 30, then they're going to do a pap smear with an HPV test. So that's a certain virus that doctors look for. If that comes back positive, you're going to come back more frequently. But that test only has to be done every 5 years. So once you're age 30, now you only have to go in every 5 years for your pap smear versus every 3 years between age 21 and 30. And the last test is for lung cancer. This is only recommended in people with a heavy smoking history who are age 55 and have quit smoking within the past 15 years or still smoke. So this is a very selective group of people. If you have a history of smoking, make sure to talk to your doctor to see if you qualify for this cancer screening program. So why should you participate in cancer screening? Well, cancer screening decreases the chance that you will die from the cancer the test is for. So that's a big reason to want to participate. For example, people who get colonoscopies are less likely to die from colon cancer than people who do not get colonoscopies. And even better, these tests can detect precancer, and this can be removed before it even develops into cancer. And once you remove a precancer, there's no chemo or additional treatment that you need to do. Your problem is pretty much solved. You just might need to do the screening test more regularly to see if it has come back or not. But you'd save yourself what might have been a cancer in the future by going to get these tests done. And remember, for colon cancer screening, you have options. So if you're someone that's really opposed to getting a colonoscopy, you don't like how it sounds, you don't want to drink the stuff to prepare the bowel, that's okay. There are other options for you, some of which are very easy. So colonoscopy is the best test. It's the one that you probably should have done. But if you're really opposed to it, there are other options. So keep those in mind. Any of the tests are a lot better than doing nothing. If you want some more information about cancer screening, here is the CDC website. Also, we have multiple videos on our website discussing these different tests in more detail, like pap smears and colonoscopies.